Hi, welcome to Wag's Cancer Journey. I'm Wags. This is my cancer journey. Well, 19 weeks removed from radiation and chemotherapy, healing process, had my second PET scan since my completion of the radiation and chemotherapy. Went in high expectations. As just a review, I had some inflammation of my lymph nodes around my neck at the first PET scan that they were a little concerned about. And they did a blood test, which they had sent to North Carolina to break down those cells. And I'm happy to report that blood test come back negative, which means they did not find any cancer cells. That is a huge plus. Super excited about that. But I didn't have somebody in a white coat with the MD at the end of their name to tell me, hey, look, you are cancer free. So I reserved I was pretty high. I was pretty pumped up. And I reserved that because, hey, I haven't been told by a physician. So I want to keep this active on my screen here so I can, some of the things I want to say. Anyway, they were a little concerned, so they set another PET scan for 6 weeks. We had that PET scan on Thursday, and everything went fine. It's about a 25-minute procedure. Once they start it, you have to take a IV that they settles you down. You really kind of sit and relax for 45 minutes before they take you back. So you folks that's never had a PET scan, it's not a huge deal if you're going to have one. If the doctor prescribes one for you and says that, hey, let's set up a PET scan, don't be afraid. It's not a big deal. So the PET scan went well. We sat down Friday with the doctor and had nothing but the highest expectations. Because this blood test had come back between the second and third, so we kind of knew the cat was out of the bag, that there was perhaps no more cancer. So we went in, sat down with the doctor, and the doctor did not use the words cancer free. And here's why. Basically, I'm glad I didn't read the results of the exam prior to sitting down with him, because he was able to explain some of the news. It's not all good, folks. Which, this is stuff that happens when you have throat cancer. When you're chemotherapy, take chemotherapy and it activates your cells to go and attack your cancer wherever it's at. In my case, the tonsil, I had a huge tumor off the tonsil. And it was attacking that, and I had lymph nodes on both sides that had cancer in them. Once that your body starts beating on them and trying to eliminate them, they'll run. And they usually run through the capillaries down to other lymph nodes, and you have lymph nodes all over your body. And they found some inflammation in the lymph nodes around my lung, my right lung. Now, this could mean that the cancer's moved down to my right lung. However, before we jump to conclusions, they also diagnosed me with having pneumonia. This pneumonia of the right lung, and that is all caused by my throat not swallowing properly and allowing liquids and food to get down into my lung, which causes pneumonia, and that could cause inflammation of the lymph nodes. There's a word for it. I just gotta find it. I didn't highlight it. I should have. Well, we'll probably get to the word. They only mention it once, which is a little concerning. But so basically, what this said was that they continued to see decrease in activity centered in the left palatal tonsil without definitive measurable remaining mass. No more mass. No more mass on my tonsil. That was the huge one. It's gone. The cancer's gone out of there. And the lymph nodes. They go in to talk about how the lymph nodes are also reduced. And then we get down to number 4. That's number 1, number 2, number 3 that they talk about. The right upper lobe and a bunch of stuff that I'll lose you on. I lost myself. I gotta take what they say, put it into Google, and have them explain it to me in layman's terms after the doctor does, because the doctor talks fast and I don't always catch everything. Excuse me, it's pretty early in the morning here in Wisconsin. You see the sun's just now coming up. So we get to number 4. New abnormal uptake within the enlarged subaortic metatarsal lymph node of the left hillier lymph node. These are indeterminate for metastatic disease, particularly the large subaortic node, versus reactive in the settling of the presumed infectious inflammatory process of the right lung. Attention on the follow-up is recommended. What does that mean? I put it into Google so I could get some explanation. I can read this. I'll just give you a brief Reader's Digest version for all you folks that are my age or older. The findings indicate that while the enlarged subaortic of the left higher lymph nodes show abnormal metabolic activity uptake, the cause is currently uncertain, undeterminate. It could be due to the spread of cancer or that's the metastatic disease that they talked about, or a normal immune system response to the presumed infection or inflammation of the right lung. So, breakdown. I have pneumonia because of my throat swallowing. That could cause the right lung lymph nodes to be inflamed. So what are we going to do? We're going to take 6 weeks, swallow, continue to do swallowing exercises, and you folks that are going to go through this, they're going to give you swallowing therapy, and you're going to roll your eyes. Pay attention. Use it. It's very important. I blew it off, and it's coming back. I ate the way I could eat. I didn't do things that they told me that I should probably do, like turn your head, put your chin down, and swallow. Try it. See, and you'll see that you can't. It's you swallow hard. Well, when you do that, nothing can go down the wrong pipe and screw your flipper flapper can't screw it up and have it go down into your lungs. Little things like that, and it'll help build your throat muscle. And you folks that haven't experienced this don't understand that you lose so much of your muscle mass inside your throat from this radiation that you can't swallow things. I swallow things, get about right here, and they stop. I take a drink of water, it kind of comes up and it goes down. Well, when it does that, that flipper flapper opens just a little bit, and some of that fluid can get down, and food particles can get down into your lungs. Well, what's it do down there? Rots, turns to infection. So the swallowing exercises are huge. So I'm doing that, but in the meantime, you still have to eat and drink. So we got to take it easy. I noticed I didn't feel good the last few days, and I don't feel very good today. Today is a 4 on a scale of 1 to 10. I do not feel good. I do not feel like eating. I do not feel like doing anything but drinking coffee and holding down the couch and talking to you folks about this. I want to get some of this off my chest because it's you get told this news, and it's just, I really thought I was going to walk out of there and order a steak because I was going to be celebrating. And instead of celebrating, I'm told I'm in another fight. So that brings me to my next point. So that's your update. That's where we're at. So all you folks that are just here to get a quick update or see if I'm still going to live through this, you naysayers that don't want me to, that I keep getting the messages from. I'm still kicking. I'm still fighting. I want to fight this. But you're not out of the woods yet. You might still win. So this pretty much ends the update. Other than the fact, I want to tell you how I'm feeling, how I'm going with this. I don't think the one thing that they haven't talked about yet anyway, is the mental, what this does. It's the PTSD, if you would, which I don't want to compare this to a combat vet, okay? It's not at all. But what I am is, it's traumatic. It's a traumatic event. They don't talk about the mental, what's going to do to you, how it's going to affect you mentally during and after. It's huge. I can't even really put into words what it's done to me mentally, but I am definitely not the same person. I mean, it's me, but it will work so hard on your depression. It will try to bring every evil demon out into the fight, into the fold, if you would. It's not a favorable position to be in. And I don't think to talk about it enough. And I think I want to make everybody aware that I don't care what cancer you're going through. Once you go through it, you got to take some time to reflect and put everything in perspective, and so you can deal with things mentally. Because if you don't, you can't, with good, you can't go through the neck exercises and the mask that they're getting me to wear to drain my lymph nodes up here where they did all this work, and the lymph nodes are being lazy because they're still recovering from the radiation. And I got to do this massage to get the lymph nodes moving, and hopefully it'll get past this. And it all wants to go to the heart, and all the fluid that goes through your lymph nodes goes into your heart, gets pumped out, gets separated, gets sent down to your kidneys. It filters, and you pass it. All that, if you don't deal with it mentally, you can't. You'll not do this. You got to deal with things and be in a good spirits mentally to go through all these different therapies, stuff that I don't talk about. My friends, most of my family have no idea of the different therapies that they prescribe to help you get through things. It's scary stuff. But I got this mask they want me to wear at night that's supposed to massage this stuff. Looks like a face mask, except it's more open. Might wear it snowmobiling. Not always in a good place. That's life, and that's how it goes. But I've got a lot of work to do today. It's the Christmas season. I will put out another update before Christmas. I have a PET scan right before Christmas. And that PET scan is going to see if this inflammation goes down, if the inflammation goes down in the chest, because I'm doing things correctly up here. Good to go. Continue to heal, which, by the way, they told me I'm the lowest 10% of healing. I have not healed. I'm in the lowest 10%. I got to contribute that to not doing what I'm supposed to do. I got to contribute that to the thrush that I've had for months, that I kept fighting, keep coming back, wouldn't allow my throat to heal. It's probably the big one. Coors Light probably doesn't help. I know it doesn't help. It probably hurts. Probably help the thrush. Renee says it puts yeast and keeps the yeast in my mouth, and I think she's right. So cutting that out of my diet, all that, try to get, I'm in the lowest 10% as far as healing. That's not me. It's not who I am. So we're going to work on all that. But I will try to get in here before Christmas. But we're still fighting. It's still a fight. This many weeks out, however many weeks I said it was out. But for Jim, Wag's Cancer Journey, we're going to keep fighting. You take care of each other, and I'll see you soon.